Hi, I'm Dr. Serino. Um, this is a summary of the article entitled, What Does Normal Blood Work Mean? And I'm going to come at it that normal does not always mean that there isn't a problem. Remember, these are blood tests that are checking the current state of our blood. Some of the tests are functional tests where they check the function of the liver, the chemistries that check the function of the kidneys, the electrolytes, the blood count. However, none of these tests can really tell us why we have a problem at times. There are things that certainly will be picked up. For instance, if you have anemia, iron deficiency, and that can contribute to a lot of concerns, including fatigue, restless leg syndrome. It will show up on the blood work, and the parameters will verify that. But realize that sometimes a normal blood work does not mean that there isn't a problem. So start with the body first. And when someone has a symptom such as fatigue, someone has a symptom such as leg pain or swelling, that this is a physiologic process often where the body is adapting to a stressor and is, in a sense, leaking or backtracking. And some of those findings are the symptoms that we have or the signs that we have. So starting with something is not quite right is the way to go. And blood work is a quick way to capture and determine if something can be picked up. However, that does not mean the tests end. And so one thing I'll look for is the possibility that the blood work is on the upper end of normal or the lower end of normal. And that could also indicate there might be a developing process. And so sometimes repeating blood work after 3 to 6 months if needed, if the process hasn't resolved. I would also suggest that your doctor and you discuss further workup. There are a number of functional tests that we can perform depending on what your symptoms are. For instance, if you're having sleep problems, to indicate possibly need for further working up your sleep, sleep apnea testing, having a sleep evaluation performed is useful. Remember that this can leak into your day. It can increase your feeling of tiredness or fatigue, as well as challenge your coping abilities, and can lead to weight gain and other metabolic processes. And so the other thing that I think about that comes out occasionally is a metabolic syndrome. And that is when someone is overweight and it taxes the body in different ways, even though the blood tests do not always show it. Sometimes they'll have a normal hemoglobin A1C value or glucose. However, if you were to get the right test, sometimes it would indicate. However, it doesn't really change much what the clinical findings are and what the history are. So number one, blood tests do not tell you that there isn't a problem. So if you have normal blood tests, it doesn't mean that there is no problem. Continue to search with your doctor, continue to think and brainstorm that your body is presenting signs and symptoms that something isn't quite right and that needs to be worked up. Number two, normal blood work doesn't indicate that there is no need for further workup. It is just a quick check, and sometimes repeating the blood work can indicate there is a difference that's developing. What is normal also is important to understand that sometimes it's not necessarily getting the full range of blood tests that you normally would do, but it's also looking past that, getting specialized tests. One of the tests that I often will consider in people that are chronically fatigued, particularly if they have other complaints, is the possibility of Hashimoto's thyroiditis. which is an inflammatory condition where there are ups and downs, and sometimes you can have a normal thyroid level. So in some cases, I'll check for thyroglobulin antibody and a thyroid peroxidase antibody, as this can indicate the possibility of Hashimoto's thyroiditis. Now, none of these conditions are islands upon themselves. If one is eating food that is very reactive and can lead to inflammation, then that can potentially predispose a person to develop conditions that are related to inflammation, including fatty liver, autoimmune conditions, including thyroiditis, psoriasis, and eczema. So realize that blood tests are only within a range of benefit, and that often we need to search further. That includes doing additional blood tests that are more specific. Again, we're not talking about throwing a Hail Mary and just kind of doing everything, getting antibody tests and all of that. It's really specific to what the needs are, what the potential risks are. And if there is no clear cause, sometimes trying to verbalize better what those problems are and reevaluate along the way with periodic visits may be necessary. Thank you so much, and subscribe to Your Health Forum. And there are other articles that relate to what is health and ways to achieve optimal health. Thank you very much. I'm Dr. Serino.